Hello. Welcome to the Diabetes Podcast. Today I invited 4 special guests to help educate us on how type 2 diabetes works and what diabetic patients should do. Please welcome Ms. Patel, Dr. Tran, Dr. Thakur, and Dr. I'm Ms. Patel, an RDN, a registered dietitian nutritionist. I graduated with a bachelor's degree from an American Diabetes Association or ADA approved program. After the program, I completed an internship that lasted around 9 months to train and learn more about the effects of nutrition on everyday life, along with how to educate the public about issues relating to nutrition and food safety. I can help diabetic patients understand the importance of eating the right foods and watching what they intake.
Hi, I am Dr. Tran, a primary care physician. I have 4 years of pre-med, 4 years of medical school, and 3 years of residency under my belt. I'm also licensed from the U.S. Medical Licensing Examination and several board exams. I specialize in internal medicine or adult care. Some of my responsibilities include diagnosing illnesses in patients, examining patients, taking medical histories, prescribing medication, and ordering, performing, and analyzing tests. When it comes to diabetics, I diagnose them. I also inform them of what they can do to manage their diabetes, and I recommend them specialists as needed.
Hi, I'm Dr. Thakur, MD. I'm a psychiatrist. I graduated with a doctor's degree from the American Psychological Association's program, APA, after working for 7 to 8 years in medical school and completing a 1 to 2 year internship, earning my PhD in psychology. My medical specialty is devoted to the diagnosis and prevention and treatment of mental disorders by prescribing medications and treatment and registering tests, analyzing medical data, and holding regular discussions with my patients. When it comes to diabetes, I can provide tests, medication, and therapy advice, and recommend other medical specialists if needed, so diabetics can manage their diabetes and irregular side effects.
Hello, I'm Dr. George, MD, PhD, and an endocrinologist. I received a doctor of medicine degree from the American Medical Association during my 4 years of medical school and performed an internal medicine residency with a specialized endocrinology fellowship. I assist diabetics like you by diagnosing and treating hormonal imbalances through diet and blood sugar reducing medications and managing your use of diabetic technologies such as insulin pumps. On to the guide.
Okay, so my first question is, what is diabetes?
Diabetes mellitus is a group of chronic diseases which affect the balance of nutrients in your blood caused by hyperglycemia, which are greater than normal blood sugar levels. Since you have type 2 diabetes, your cells have an insulin sensitivity and cannot respond to insulin binding to cells and allowing glucose to enter into the cytoplasm. In order to diagnose your illness, doctors use glucose tolerance testing, which describes how the body encourages the uptake of glucose in cells. Changes in blood sugar levels from a base level were recorded after you drank a concentrated sugar solution, and once it was discovered that you had diabetes, your type was determined by insulin tests to describe how much insulin was secreted by your pancreas. To further explain, the normal feedback mechanism in response to hyperglycemia within your body is as follows. Beta pancreatic cells, when sensing hyperglycemia, secrete insulin to the bloodstream. Insulin binds to insulin receptors, which causes glucose to enter the cell by glucose transport proteins. Blood glucose levels decrease eventually to normal glucose levels. Within type 2 diabetes, the pancreatic beta cells secrete appropriate amounts of insulin to the bloodstream to regulate the movement of glucose in your cells, but the insulin receptors don't adequately respond. This prevents the normal wound of glucose into the cell and the intended negative feedback mechanism. Eventually, the pancreas cannot compensate for constant hyperglycemia, leading to further complications. This develops within adults and obese individuals. To further understand the nature of your disease, the symptoms of diabetes that you may have presented must be discussed, including excessive thirst caused by the body aiming to replenish water volumes in cells lost by the movement of water in the bloodstream due to hyperglycemia, fruity breath, fatigue caused by the lack of glucose in your cells to produce ATP, ketones in urine, mood swings, excessive urination and sweating caused by your body trying to remove the excess water which was in your bloodstream caused by such hyperglycemia.
Can you please teach our listeners about the diet that they should be following? Yes, it's important that patients with diabetes are careful about what they eat or drink to prevent glucose levels in the bloodstream from getting too high or low. There are foods that you should avoid, like simple carbohydrates. That means sugar, pasta, pastries. Usually foods with simple carbohydrates have high fructose corn syrup, artificial sweetener, and added sugar. Patients with diabetes should also be avoiding alcohol because they can raise blood sugar levels due to the concentration of sugar, such as in cocktails, beer, and wine. Opt for a more calorie-free drink. You should stay away from saturated and trans fat, which are often labeled partially hydrogenated and usually found in deep-fried foods. Most of the time my patients ask me, well then what should I be eating? You should be eating foods such as complex carbohydrates, which include brown rice, oatmeal, beans, and lentils. These foods suppress hunger and prevent the body from producing excess insulin. You can also eat unsaturated fats. They are mainly recommended from plant sources like nuts and seeds, or from animals like fish. Unsaturated fats lower blood sugar and are shown to slow down absorption of carbohydrates. Proteins is also a good source because they provide steady energy with little effect on blood sugar. It keeps blood sugar stable and can help with sugar cravings and feeling full after eating. Examples would be beans, seafood, dairy, and lean meats. And of course, vitamins and minerals, which can be found in fruits and vegetables. If you want to plan out a proper meal, I can give you examples, some with healthy foods and substances. For example, wheat bran cereal and dried strawberries and milk alongside orange juice with vitamin A, C, and several minerals can make a proper breakfast. A proper dinner would include baked or grilled fish with sides of sautéed carrots, tomatoes, and other vegetables, which would provide the necessary molecules of protein, unsaturated fat, and some carbohydrates, vitamins, and minerals. Planning core meals and snacks are extremely essential within a diabetic diet, and keeping a food diary can help record your problem areas and help assist your nutritionist. We call in my close friend Dr. Tran to talk about exercise and physical activities.
Because you have diabetes type 2, it is essential and beneficial that you do the right exercise and start to incorporate more physical activities into your daily life. Benefits include stronger bones, better sleep, stress management, lower blood pressure, and much more. It allows you to have more control on your blood sugar levels because exercise can reduce the amount of glucose in the blood. Glucose is used by the muscles in exercising without the need of insulin. Exercising is also proven to reduce resistance to insulin, which means glucose is allowed to enter into the cells more effectively, and you can develop better use of glucose over time. Patients with diabetes type 2, such as yourself, have many health risks, such as heart disease and stroke. But exercise can decrease the chances of those risks. Exercise can also help lower cholesterol levels. For example, aerobic exercises such as dancing, swimming, Zumba, and much more are a good way to get up and move. The medication of diabetes type 2 can vary depending on the impact and the condition of the disease. Metformin works by lowering glucose production in the liver and improving your body's sensitivity to insulin so that your body uses insulin more effectively. Insulin therapy is when insulin is injected into the body and is used as a last resort. Doctors may also prescribe medicine for blood pressure and cholesterol, which can help reduce the risk of heart and blood vessel diseases.
Dr. Talker, our listeners have been asking if you can please talk about blood glucose monitoring.
Depending on diabetic needs, blood sugar can be checked up to 4 times a day, even when taking insulin, though type 2 diabetes doesn't have to be checked that frequently. Normal blood sugar levels are about 140 milligrams per deciliter or less, while type 2 diabetic blood sugar levels are from 200 milligrams per deciliter or higher. Before a meal, they should be controlled to about 70 milligrams per deciliter to 130 milligrams per deciliter, and 1 to 2 hours after a meal, they should be 180 milligrams per deciliter or less. Though these levels do vary depending on a diabetic and their doctor. If a diabetic is hyperglycemic, which means they have high blood sugar levels, if it's not controlled, it can cause excessive urination, thirst, tiredness, sudden weight loss, nausea, muscle weakness, blurred vision, fatigue, cardiovascular diseases, and some serious side effects, such as diabetic ketoacidosis and hyperglycemic hyperosmolar state, which can lead to life-threatening dehydration and diabetic coma. A diabetic's glucose can also be monitored using a glucometer and taking the A1C test frequently. The glucometer will analyze the amount of blood sugar currently in one's body, informing the diabetic of what they should do next, while the A1C testing is recommended by a doctor where it measures the average blood sugar levels from the past 2 to 3 months. In the A1C testings, getting a 5.7% levels or less is considered normal. Getting a 6.5% or above means diabetes and needs to be taken care of immediately. Treatment and medication can be taken to stabilize unstable blood sugar levels, such as taking insulin injections or an insulin pen daily, or when needed. A newer and more advanced method is using an insulin pump that regularly checks your blood sugar throughout the day and delivers a specific amount of insulin to your cannula through tubes. Oral and other prescribed medications for type 2 diabetes, either such as that control your blood sugar, such as metformin or glucophage or glutamate. They can either stimulate your pancreas and produce more insulin. They can inhibit the production and release from glucose from your liver, so therefore you would need less insulin to transfer sugar into your cells. Or they can just block the action of your stomach or intestinal enzymes that break down your carbohydrates or make your tissues more sensitive to insulin. Type 2 diabetics, they can also be hypoglycemic, which means they can have low blood sugar. This can also be monitored using a glucometer, but the treatment varies, as instead of decreasing glucose levels, we add sugars to the bodies. So hypoglycemia occurs when there's too little sugar, or even when too much insulin has been taken into the body, around when the levels are around 60 milligrams per deciliter or less. Some signs include anxiety, hunger, nausea, vomiting, and blurred vision. To stabilize low blood sugar levels back to normal, a diabetic can either take glucose gels or tablets regularly throughout the day, or they can take in natural foods, such as 4 tablespoons of sugar, a fruit juice box, drinking 1 or 2 cups of soda, or 4 to 6 pieces of candy, which are not sugar-free. In serious conditions, you are treated by being injected glucagon, which is actually supposed to be released by your alpha pancreatic cells when your blood sugar levels are too low, which in response later get turned into glucose, which later gets stabilized using insulin, and they bring your blood sugar levels back up.
Thank you. That's it for today's podcast. We hope to see you next week.